Dr. Everett Evans, represent myself.
And you're for the bill?
I am. It's getting pretty late. I can kind of tell. It looks on everybody's faces. Just kind of a little personal background. I've been treating Medicaid patients for about 5 years now. Recently opened some dental practices about 3 years ago. Started with one in Denton, Texas. I currently have 4 practices in DFW. I have 2 practices in El Paso, 1 practice in Laredo, and 1 practice in McAllen, Texas. We tried to focus on a good patient experience. Most people, when they walk into our offices, they say, is this Disneyland or is it a dental office? We have a storybook theme. Every patient's called back as prince or princess. We say we treat patients from 0 to 99, so even if you're a little bit more mature, we still call you back as a prince or princess. We have a crowning ceremony at the end of anyone's dental adventure, where they get crowned a king or a queen for being so brave. We have multiple themes. We have a castle theme, an underwater theme, a jungle adventure theme. So we try to really focus on a fun dental experience. Something else that we've done is when we opened back in 2010, we hired a lady by the name of Sherilyn Fitchell. She was a former investigator with the State Board of Dental Examiners. She's a former Department of Public Safety state trooper, so extensive law enforcement background, and she worked with us extensively to initiate a strong compliance program. We were going for about 3 years, and then we had an encounter with the OIG. So, and I gave you that background because we had worked so hard to create a compliance program so we could avoid any issues with any kind of regulatory agency. So, our interaction with the OIG began with an initiation investigation. It extended to a 100% payment hold. In response to that, we laid off 120 employees. Displaced about 40,000 patients. We then, within a few weeks, we had 75% of that hold lifted, and now we're currently possibly going to have more lifted. And my biggest concern kind of with that whole process was the fact that we laid off 120 people. We displaced a ton of patients, and then after a period of just a few weeks, it came back around to, I guess we can lift this hold. I guess things are looking okay. And my concern was, well, why didn't we have this conversation before the hold was put in place, as opposed to waiting till after 120 people lost their jobs and 40,000 kids get displaced who are receiving dental care? So really there's kind of three items that I'd like to kind of just bring up about this bill. I am in support of it. I'm in support of due process. I think that's a fundamental issue of America, this idea of having due process. Number one is the idea of temporary. The federal government and Texas OIG both define a payment hold as follows. A payment hold is a temporary denial of reimbursement under the Medicaid or other HHS program for items or services furnished by the provider of interest. However, currently on the OIG website, they interpret temporary as follows. This stoppage, meaning the payment hold, is considered an administrative sanction that stays in place until the matter in dispute between the provider and the HHSC commission is resolved. So what is temporary? Is that 30 days? Is temporary 60 days? Is it 6 months? Is it a year? Is it 2 years? There's a lot of confusion around this idea of temporary. Fortunately, actually, Dr. Kyle Janik, Executive Commissioner of HHSC, he was recently on an interview with the Texas Medical Association, and he defined temporary for us. He said 30 to 60 days max on a payment hold. This is the Executive Commissioner of HHSC. He says his interview is available on YouTube, anyone that wants to see it, at minute 21 and 22 seconds. He says in reference to cap holds, he says, the important thing there for the docs is this should not drag out 2 months, 3 months while they are waiting. These doctors have cash flow issues they have to manage, close quote. So currently the reality is a lot different than that. There's doctors that have been on payment hold for many, many months, some of them even years, going out of business, as you've heard other people talk about today. So I believe that this committee can do a lot by defining the idea of temporary and what that actually means. As Dr. Kyle Janik discusses, it should not be so long that a provider is going out of business while they wait. Okay. Number 2 would be the federal exclusions on the hold. This bill goes to great lengths to define credible allegation of fraud and talk about the things that a credible allegation of fraud is and the things the state should do. And we're always hearing about how the OIG is afraid that, or everybody's afraid that the feds are going to come back and claw back all these dollars related to a provider if fraud is eventually proven. The fact of the matter is the federal guidelines actually provide exclusions that give the state latitude in determining the administration of a payment hold. And but it's kind of interesting, all of the enforcement language and definitions are included in this legislation, but the exclusions are starkly absent. There's no mention. The four instances, it says, upon specific request by a law enforcement agency, a payment hold should not be initiated or may not be initiated. If the state determines that another remedy could more effectively protect Medicaid funds, then the payment hold doesn't have to be initiated. If the state determines that the suspension is not in the best interest of the Medicaid program, the hold does not have to be initiated. And if the state determines that a suspension will have an adverse effect on beneficiaries' access to care, a hold does not have to be initiated. So that language is absent from the bill, and I think it would be a good idea if that might be included. So I believe that inclusion of those federally defined exclusions would be appropriate. In my particular case, we had 40,000 beneficiaries that were displaced as a result of the payment hold, and 117 healthcare employees, or 120, were laid off within 1 week. My hold was later reduced. But if the displacement of 40,000 Medicaid beneficiaries and laying off of 120 healthcare workers does not have an adverse effect on beneficiaries' access to care, I'm not really sure what would. But I think it would be helpful if we might include something like that. And then the last thing that I would mention, I would actually ask, I'd really be interested if the OIG were to provide some outreach and educational efforts to providers. Most providers are actually interested in operating in a compliant way. I personally have attended compliance sessions put on by the Center for Medicaid and Medicare Services. I've attended nearly every HHSC stakeholder meeting that's held every single quarter. And I actually believe the OIG would be open to this concept. In 2011, Inspector General Doug Wilson actually made the following comment during an interview regarding reaching out to and educating providers. I quote, "I think that's a place where we haven't been as effective as we could be. We're required to provide training to providers, but we haven't been aggressive in that regard. That's one of the things I've been talking to the staff of the OIG about, boosting our communications and trainings for providers. And when we're invited to train providers, we should try to accept those invitations. There's been some hesitancy expressed about that, some concern about giving away trade secrets or how we conduct our investigations. But my feeling is we have an obligation to make sure providers understand how they're supposed to go about conducting and documenting that work." I really couldn't agree more. I think Inspector General Doug Wilson really nails it there. Any kind of outreach and proactive training of doctors and providers, I think, would be very well received and would be very much appreciated. I could tell you I'd be front and center at every single training that was offered. I thank y'all for the time. I know it's late, and I really appreciate you taking up this issue. So thank you.